To introduce our panel and to moderate this session, I would like to invite our research fellow from the Health and Global Policy Institute in Japan. She's also a PhD student from the University of Tokyo, Nyaya Harper Igarashi. Nyaya, the mic is yours. And can we invite the panelists to already take your seats? Yep, you can just follow your order in the poster.
Is it? Okay, sorry. Okay, yeah, thank you. So yes, thank you. So I'm Naya Harper Igarashi, and I'm very excited to be here today with this excellent panel. And we are here to discuss the research and evidence to advance the new agenda. And this is at the intersection, of course, of climate change and mental health. So as we heard earlier, climate change is not just about the environment, it affects our mental health as well. And despite these growing challenges, we don't have enough research yet. There still needs to be more. And moving forward, we need also global collaboration to bring mental health into the climate action and policy agenda. So today, I'd like to introduce our panel, and I'll start from here to my left. We have Emma Lawrence, who's a leading researcher on climate change and mental health, and she also leads the Climate Care Center at Imperial College London, and also the Connecting Climate Minds initiative, which provides a global perspective on research efforts in this climate change and mental health space. Then we have John Aruta, who's an environmental psychologist and associate professor at De La Salle University in the Philippines. And then we have Christina Cruz, who's a psychiatrist and global mental health researcher at the University of North Carolina, Chapel Hill. And Christina's work spans school-based initiatives in India and also the Philippines and the US. And next we have Rainer Sauburn, who's a climate health researcher and also a longtime contributor to the Intergovernmental Panel on Climate Change, the IPCC, and also former head of Heidelberg Institute of Global Health. And finally, we have also Ronald Mutasa, who's a public health expert and economist with the World Bank. So I look forward to the discussion that will not only deepen our understanding of this critical issue. And so let's begin with each of our panelists who will provide their opening statement. And I'll start with you, Emma.
Thank you so much. Renzo kindly asked me to use some slides just to sort of set the scene of Connecting Climate Minds. So I might just go to the podium. So I can see. We happy to go? Okay, they're getting a moment. I might just introduce myself a little bit while they're getting everything up. So as you know, my name's Emma. I grew up on Ghana lands in what's called the Adelaide Hills of Australia. So I was very privileged to be surrounded by trees, by nature, by birds, by koalas. And it was always inherently obvious to me how we're deeply connected. We're a part of nature, not apart from nature. And so that what we're doing to nature, we're doing to ourselves as well. And I've got a little nephew now who I'm completely brainwashing. He now claps when he sees trees. We do a lot of patting of the trees and things like that. So yeah, I'm very lucky, but I've also seen it change. I was just came from Adelaide, and it was 45 degrees the day before I left. And we were putting out water for the koalas outside my family's house. They were coming down from the trees to put their paws in it to try and cool down. But it's hard when you see the landscapes changing and the trees dying, the animals dying and struggling. So yeah, anyway, that's a little bit about the context of where I'm coming from in the world. But I'm now based in the UK at the Climate Care Center at Imperial College. And for the last 6 years, I've been looking at these interconnected crises. Come to this from a background in neuroscience as a climate activist back when I was a young person myself, and with my own lived experience of severe mental health challenges. And it's extraordinary actually to be here and just to see how far the conversation on mental health has come from when I was first diagnosed, over 2 decades ago now. And it being completely taboo and really not knowing what it looks like to have a mental illness outside of this idea of being in a straitjacket or something in an institution, to where the conversation is now about mental wealth and the idea of resilience and of love and community and connection that's come out so strongly in this conference, and the importance of centering that and of centering joy and belonging in the work that we do in mental health. So yeah, I'm just very encouraged to be here with you all. I'll just put this down. I think this one works as well. So just to very quickly situate, obviously you're all here because you know that mental health is still a huge concern. But just to note the quote on the bottom, this was from the Lancet Psychiatry Commission on Youth Mental Health that came out last year, talking about entering this dangerous phase for youth mental health. But they really highlighted how global megatrends are sort of underpinning maybe and driving some of this rising distress. And one of those trends, which is again deeply interconnected with other challenges, being climate change. Again, we've heard a lot of this, so I won't dwell too much, but we are at a critical time, not just on climate, but on crossing these planetary boundaries of what we're taking from the Earth, certainly in the richest parts of the world, being so much more than what is sustainable. But the thing is that, and the big gap is that people really want change. And so people care a lot more than we think that they care. And surveys have shown this, that actually there's a big gap between what we think other people care about and what they actually care about. And there's big narratives that are being driven by trillions of dollars from like billions of dollars at least, I think trillions now, from fossil fuel companies, to really put the onus on us as individuals rather than a collective sense of action and connection. So how do policies align with these desires and also support people through change? The world is changing and it needs to change further. So how do we, and just to say that the IPCC reports, and we've got one of the authors here today, they say that resilience in the latest reports is not just the ability to maintain essential function, identity, and structure, but also the capacity for transformation. How do we build this capacity for transformation? So if you care about mental health, why does climate change matter? I mean, it's encouraging you're all here, so it's a little bit of a rhetorical question at this point, but climate change is a risk multiplier. And so whatever we're working on, unless we consider climate change and move rapidly in the energy transition, the consequences of climate change will undermine progress on health and equity. But conversely, actually, the research on the world that we need to build, what is a mentally healthy world, that strongly aligns with what is needed for a sustainable, decarbonized world. So, we're actually working together in the same region. So health is a powerful lever of climate action. And actually, as people who have power in the community and a trusted voice in the community, you have power to speak up about the need for climate action, but to center it not just as something out there and an environmental issue, but actually a human health issue, as we heard. And psychological resilience is vital for this transition and coping with the compounding stresses that people are facing. But we're here to talk about research. So while these needs are escalating, and there is evidence that's really rapidly, I mean, it's almost exponential from a very low starting point, we see that there's key gaps in actually defining the mental health burden. What is the nature, prevalence, and severity of it? How do we measure the costs of inaction and the benefits of action, the mental health benefits and risks of climate action? The mechanisms and pathways, that they're complex. We've heard so many already, but they're interacting, and how do they work? And also, what are appropriate mental health interventions? And there's an evidence gap, even though there is great work being done on the ground around the world. The field at the moment is also very global north heavy, as you see in this cartoon. It's disconnected between all the different disciplines that need to come together, between research and policy, between lived experience and communities, researchers, policymakers, and between regions. and it's unequal. There's certain topics and regions that have received more focus. When you talk to most people about climate and mental health, they think immediately of eco-anxiety, but they don't think of someone who's, you know, as you said, experiencing like gender-based challenges because they can't access clean water. And it's siloed within funding and policy making. So Connecting Climate Minds was created to try and address these challenges. We've heard a bit about it already, and I've worked with lots of wonderful people in this room and on this panel. We had 7 regional communities of practice aligned with the SDG regions. They all had conveners, co-conveners, lived experience advisory groups, and youth ambassadors who were forming the central team across the region. And then they were interfacing and building that connection across the region with people from all sorts of backgrounds. Globally, there was a lived experience working group who led research and action agendas by and for young people, Indigenous communities, small farmers and fisher peoples. And myself with the Climate Care Centre and the Red Cross Red Crescent Climate Centre were helping kind of globally coordinate this. So this is just to show you how global the team was. These are just the leads, not everyone who was involved. There was over 1,000 people from over 100 countries ultimately involved. So we have 7 regional agendas of research and action. We have 3 agendas for populations facing amplified mental health climate change impacts, and these were synthesized into one global agenda. And so the global research and action agenda is trying to target research to ultimately provide the evidence that will help decision makers to act and provide an action strategy for how we do research, which we heard was as important, if not more important, than what research is done. And to build an understanding among diverse audiences of their roles. How do we bring people into this emerging transdisciplinary field? We really heard from dialogues. These agendas were created through dialogue. There were over 30 dialogues around the world and surveys and global events. And we heard time and time again of the compounding mental health risks and multiple interacting pathways and mechanisms. So it's not just now like, you know, disasters have always happened, but it's not just now once off. It's more frequent, it's compounding, it's interacting, but also that there is relevant knowledge and solutions held in diverse disciplines and cultures that we need to be learning from, working with, understanding, and particularly diverse expressions of mental health, which I've already heard a bit about as well, that we, you know, there's not one size fits all when it comes to describing and talking about what we mean by climate and mental health. And so there's a need for foundational field building. And just to finish in the words of Hope Lekwa, who's one of our wonderful team members from Saucy Vibes in Nigeria, he said, "It's my desire that this work inspires meaningful, lasting change that honors the courage and meets the needs of vulnerable people." And that's what we heard so much, is not just about vulnerability, but unique sources of resilience, and you know, working towards that vision of where we're better connected and where we can help people actually not just survive but thrive. So we hope that you join us, and you can check out this hub.connectingclimateminds.org, where you can join the Collaborate area, meet others from around the world, check out the toolkits that are created, case studies, lived experience videos, and all of the agendas. And you can see some familiar faces at this gathering in the Caribbean almost a year ago. So this is kind of a reunion for Connecting Climate Minds, and we want to expand and extend the invitation for you all to join us. So thank you so much.
Thank you very much, Emma. So next, how about John? You can share your opening statement.
Hello, everyone. Good morning. So apparently my slides are not available, so I'm just gonna do this. I'm John. I'm from the Philippines, the most climate vulnerable country in the world. We have more than 7,600 islands. Sea level rise, we feel it firsthand. We are based in Southeast Asia region, where heat increase and temperature rise is very much felt. In 2024, we experienced unprecedented increase in temperature. And for a poor country like the Philippines, living in little ovens, it's really a real struggle. I remember my earliest memory of climate change was when I was a little child, probably 3 or 4. There was a huge typhoon that hit the Philippines. Our semi-concrete house was damaged. I remember the roof was flying. I remember the wall was disintegrating, and my mom, I saw her in the corner of our house, kneeling and crying and praying. In the eyes of a child, that's something that you would never forget. It was so traumatizing. And fast forward 30 years, I turned out to be a mental health professional working in the climate change space, providing mental health services to young people, children, and young adults in my country. As an adult, what the turning point really for me was when Typhoon Haiyan, the strongest typhoon in human history, hit the Philippines. 6,000 people died. That's an underestimation because 1,000 others were missing. Thousands of families were displaced. Until now, they don't have proper houses. And we volunteered to provide psychological first aid. It was tough because how could you provide psychological first aid when you see dead people on the street? You yourself was traumatized as well. And so I realized that I could apply my training in psychology to help in fighting against the climate crisis. And if you attended our workshop yesterday, you know already that I work on climate change and mental health. But one thing that I did not mention enough is that I work in the climate justice space. Part of my work is I look at how different forms of climate injustice manifest psychologically or impact people's mental health. We know that people in the global south are more impacted by the climate crisis, but also by the mental health consequences. And women are more impacted by any disaster, including climate change. Now, when disasters happen, they have multiple layers of consequences and responsibilities. COVID tells us a very important lesson on that. It's also an issue of intergenerational justice, where young people who did not cause climate change will face the increasingly severe consequences of the climate crisis. So I try to make that part of my work. In the Philippines, we are a hotspot of murders of environmental defenders. So there are initiatives where I lead developing mental health interventions specific for environmental defenders in the Philippines. And I had the privilege of continuously working in that space. And I just want to share that I'm also part of the Connecting Climate Minds. I had the privilege to work with Renzo to co-lead the East Asia and Southeast Asia part of Connecting Climate Minds, where we identified what's missing in the climate and mental health nexus in the region. What do we know? What we don't know so far? What would be the next research and action agenda in the next coming years? And what would be the pathways for us to really understand the connection between the emerging climate change and mental health space? I would like to tell you more when I share during the panel discussion, but for now, thank you so much.
Okay, thank you very much, John. Okay, next, Christina.
I'm just going to sit here if that's okay. Great. So I'm Christina Cruz. I'm a child psychiatrist, global mental health researcher. Much of what I do is in schools, teaching teachers how to respond to students in the moment of mental health crisis or struggle so that in that moment, the child gets a microdose of therapy and then they get better. And I introduce that to say that that's how I think about climate change and mental health as part of the whole thing. As a physician and a researcher, we see that research is important. It is what you can feed to policymakers and should be the basis of care. And on average, it takes 17 years for it to come into practice. And so my message today is going to be about working as quickly as we can to get the evidence we need and then to move. And that's behind what we do in my program, Tea Leaf, because whatever we think is happening, that someone is suffering right now, and we can do something right now. And so I think to be able to move quickly, the way one does in psychiatric emergencies, which is what I'm used to clinically when I practice, I'm an inpatient child and adolescent and eating disorder psychiatrist at UNC when I'm practicing. We know we need to move. And so that's where I want to start from today is let's do the research, let's do it quickly, and then let's move, because the disasters like in the Philippines, as John was saying, is already happening, or in schools, kids are already falling behind, and we know with climate being a risk multiplier, as Ahmed said, it's just getting worse right now. So we don't have the time to create the most beautiful of studies. We put stuff out there and we go. So good morning, everybody.
Thank you very much, Christina. So next, Rainer.
I'm Rainer Sauerborn from Heidelberg in Germany. I'm a pediatrician, and in my path towards coming here, I became first a global health, public health physician, and then a researcher, interested then in climate change since 2000. So 25 years, and I'm at the university, so we are trying to research the link. There are 120 and counting climate-sensitive diseases. That means diseases that are aggravated by climate change. And mental health is a big chunk, but not the only chunk. So since this is about research and evidence, I thought I will share with you how we approach the issue from a research angle. So climate change, you can't study because it takes 10, 20 years to change. So usual research projects are 3 years. You get funding and then you leave. So you can study weather variability as a proxy, and weather goes up and down and up and down and up and down. Most mental, and I'm not an expert, most mental diseases, particularly mood diseases, go up and down and up and down. So any cross-sectional shot is going to be biased. It's going to be wrong, misleading. So in an ideal world, you would follow a community for 10, 20 years in its up and downs of health, and relate this to the up and downs of, let's say, temperature events, extreme events. They come and go. So you need to be longitudinal. How is research usually done? The low-hanging fruit, meaning you go to a hospital. Where are the mental health patients? When were they admitted? What was the temperature before? Easy. We all can do this. And you find, lo and behold, there's a strong heat relationship of almost all mental diseases. And I thought it's mainly depression and mood disorder. No, it's schizophrenia, it's organic, it's dementia, it's neurotic. So that's the low-hanging fruit, because not everybody goes to the hospital when they feel bad, particularly not the mental health people. So we used another tool, which is there are 65 cohorts, meaning whole populations, let's say communities, 100,000 people, followed up, some for 60 years in West Africa, some for 10 years. There are some in Seko, we are going there in Malaysia, some in Indonesia, Selman, Gajah Mada, and so forth, and in Africa. And they are, everybody is registered in a computer, and you follow them by regular visits. How do you feel? Well, I come to the how do you feel, but what illnesses have you had? And then there are apps. How do you feel today? Not today, now. EMA, ecological momentary assessment. Yeah, with my wonderful team sitting there, from whom I'm learning to do this. So you have the minute you get this question, how do you feel today? Like you asked, how do you feel now? And then you do this every day, and then you get a profile of mood, and which is a good indicator for a lot of problems. Yes, you can do the WHO questionnaire with 50 questions. There are small questionnaires, and we are integrating this now into these cohorts, who are followed up for a long time. We call it CHEERS. That means Climate and Health Evaluation, Early Warning and Response. I sent you the paper. If you can share it, if somebody's interested, read it. And I think there should be one of these in the Philippines, and there's none. You're an established one. Yes, yes. So that is a kind of glimpse. It's very difficult to do research on the link between climate change and health, even more to evaluate interventions that are supposed to alleviate at least the climate impact on mental health. There are ways, you know, there are some drug reductions or increasing how mental health patients living with mental health problems are registered by their patients, and they get some advice how to behave, and very often they're not aware of the threats and so forth. So there are adaptation, as we call it in the climate world, or meaning protection measures for them. Thank you so much. Time is up, I read. Thank you.
Thank you so much, Rainer. Next, we have Ronald. Please.
Thank you. So hello, everyone. I'm Ronald Mtasa. I am the manager for the health practice at the World Bank for East Asia and the Pacific region. Just want to acknowledge our counterparts at the National University of Singapore, Dr. N. Clare, for the partnership, and also quite a few of the government counterparts across the region that we work with, Indonesia, Mongolia, Vietnam, who are here in the room. Very delighted to see you all. So, of course, I come from a development bank, and we work with governments to really prioritize important policy actions that not only have got public health implications, but also the economic implications. So quite delighted actually that we have this opportunity to meet practitioners, researchers, and also policymakers and influencers. I will just begin by mentioning 2 points. The first part really that's very crucial is to understand how climate change and mental health basically interact. And the first part is basically the direct pathway. Based on the work we've been doing in the World Bank, we know that there is a lot of direct impact, particularly in terms of disrupted access to healthcare, trauma, and also displacement that impacts a significant chunk of the population in East Asia and Pacific, particularly for the archipelagic countries, Philippines, Indonesia, as well as, of course, a lot of our Pacific counterparts. So developing a clear understanding of that direct pathway obviously is very important. And of course, this is where I think the researchers come into play, because why is it important is because how that impact happens differs by country and also by context, because of geography, and also because of way of life, and also because of the physical infrastructure within which these countries are developed. So it's a very important area that we need to develop knowledge around. And of course, that basically leads you to very practical and concrete action. Second area is the indirect pathway, basically looking at the political, social, and economic determinants of mental health. And by looking at the social and economic determinants, it's also very critical because we do know that the climate change related impacts on mental health tend actually to affect the poorest segments of our society. And that poorest segment is actually the one that is least prepared to cope with the impacts. It's also the least prepared to recover after a climate-related shock or event. So it's going to be quite important that we also apply an equity lens in our development of research and knowledge, and also the policy actions that we should be taking forward. So in the World Bank, we do support what we call policy research, which is research not for the sake of just research, but it's research that's really meant to influence policymaking. In our conversation with government of Indonesia in December, they were very clear that, look, there's an slowly growing acknowledgement that mental health is such an important issue for one of the largest economies in Southeast Asia, but it's not yet there at the top of the policy priorities. So in our conversations, we're discussing how do you do the agenda setting in order to move mental health to be on top of the policy priorities. So it's great that we have this opportunity, which I do feel is actually an Asia-wide agenda setting. So many thanks to National University of Singapore for pulling this off. I'll stop here for now. Otherwise, I'll get flagged for being over time. Thank you.
Thank you very much, Ronald. So as you can see, we have our panelists here from across various disciplines and geographies, and we heard about some of the gaps that still remain. How can we translate that into policy? We're going to have a few questions. I have a few questions for you all, and we'll also have time for questions from the audience as well. So I'd like to start with Emma. So you talked about the gaps that remain. Could you go a bit into more about some of the emerging themes that are that you found during the research?
Yeah, thanks so much. So the global research agenda has 53 priority research themes. We were trying to consolidate, but there's so much richness. You know, this is a really big area when you start to unpack it, and also globally. But that was under 4 key priority areas, and as well as the foundational themes. So spoke about this kind of conceptualization. You know, we talk about climate, mental health, but what do we actually mean by that? How does that get measured and described appropriately, particularly, you know, when we're looking at different cultures, different communities around the world? And how do we, you know, bridge that need to be very like locally focused with the big picture perspective of actually capturing the mental health burden associated with a changing climate in order to push policymakers and funders to invest? And also, how do we measure, when we're talking about measuring, evaluating interventions, what's actually important to measure here? What does success look like? What are we capturing? And so that foundational field building, also capturing what already works, what methods are coming in from different disciplines into this very transdisciplinary field. And there is some work that we're doing based on that, working with Professor Gary Belkin, his COP2 network. We're bringing together the Connecting Climate Minds network with his network is already working with people on the ground who are implementing climate adaptation and resilience and integrating psychological resilience, mental health support into that. But we're then starting to partner and say, okay, how do we sort of accompany, as research, accompany this work and share, learn from what's working and share the kind of key lessons up with sort of multilateral fora and back down to the ground. So we're trying to put those things in place, but that's the sort of foundational themes. And then there's the 4 kind of high-level categories. The first was impacts, risks and vulnerable groups. So again, you know, how do we capture and understand these risks? There was and impacts, and there were sort of definitely a lot of sub-themes, but we heard yesterday also around the interaction between, you know, what we sort of talk about as climate change with ongoing historical and current traumas of colonization, of other sort of extractivism, of commercial determinants, of political determinants, of environmental determinants, of social determinants, of biological determinants. So there's a lot of different impacts, and then this goes into the and groups that are affected. And then this goes into the second category, which is pathways and mechanisms. So how do we actually understand the multifaceted ways in which a changing climate ultimately interacts with mental health, but also the other way, right? That how does psychological resilience interact with our capacity to act? How does climate action interact with mental health, and what are those pathways? And that goes into the third category, which is how do we actually capture and measure the benefits and also sometimes the risks of for mental health of climate action, because also we should acknowledge that sometimes conservation efforts can displace people from, you know, their communities. There is you know, people are losing their jobs in the energy transition. So that's you know, a small fraction compared to the massive benefits that can come, but it's still important to acknowledge that there are risks as well as benefits. So but there is benefits on multiple levels of individually, communally, at a society-wide level. If we think about, you know, changing buildings or more trees in cities. We talked about trees and how that provides the climate adaptation cooling effect, particularly for vulnerable groups who are more vulnerable to the urban heat island and the mental health effects of heat. But so it's a climate action, but also mental health action, but that's not really being captured yet. So how do we measure and capture that? And then finally, what are the mental health interventions that are appropriate in the context of a changing climate? And sometimes that's interventions that already exist. And when we say interventions as well, it's quite broad, right? There's a range of tools, support, solutions. But then also there might be some new things that come, and John talks about, climate aware mental health professionals. What are the tools that can already be applied, and what's different, what's unique about the context of climate change? Even for disaster psychiatry, when there's, people aren't able to have the time to recover before the next disaster hits, what are the implications of this? So those are the 4 kind of high level categories.
Okay, great. Thank you so much, Emma. You talked a lot about the most impacted. Of course, we know vulnerable groups, and you talked about some interventions. And that brings me to, actually, I have a question for both John and for Christina. You can answer separately, but I know that you are working, in most directly with vulnerable groups and working on interventions. So starting from John, I'd like to hear more about some of the interventions that you're doing on the ground in the Philippines.
Thank you, Niaya. So far, the interventions that we use are not really specific to climate change and mental health because it's an emerging field. So we need to draw from the existing interventions in the mental health field. In my practice in the Philippines, I personally experience an increase of intakes reporting climate-related problems or distress. So, for example, there's this medical personnel who has been my patient in the past 1.5 years, and then one time he goes to Vietnam. That this during the summer, the 2023 at the time, the unprecedented heat. She has diagnosed with generalized anxiety disorder, and she was healing after several, no, recovering, managing after several weeks of therapy, and then she went to Vietnam, feeling well, and then went outside to go to the market, and then suddenly she felt all the symptoms. There's no particular trigger except heat, and then she was rushed to the emergency room with, and then she reported that there are 5 other patients in the emergency room reporting the same symptoms, reporting that it was the heat that triggered their distress. But this is just an example that climate change can come in different entry points. It can either trigger or exacerbate already existing mental health problems. So we use the existing interventions that we have, and we hope that the direction in the future is that we create climate-specific interventions. But I'm hopeful about the nature-based intervention because we know in evidence that exposure to nature provides not only reduction in depression, anxiety, and stress symptoms, but also increase of well-being and flourishing. Mental health is not only absence of psychopathology, but presence of a flourishing life and well-being. And nature-based intervention, I think, is very important, especially in developing countries like the Philippines, many countries in Southeast Asia and South Asia, because this is a low-cost intervention. Especially when our governments don't allocate sufficient funding for health in general, more especially the always neglected mental health. Now, nature-based intervention can come in as one of those potential interventions for mental health. Thank you.
Great, thank you so much. So, Christina, I know you have the Tea Leaf project, and so I would love to hear more about that, and I'm sure everyone else would as well.
I'm happy to talk about it. It actually doesn't quite address climate change and mental health. So I'll talk about a little bit, actually talk about what we are doing in climate change and mental health. So Tea Leaf is about teachers being empowered to address students' mental health in the moment for grades K to 6. The way this is applicable in climate change is because kids are coming in with all kinds of stressors, right? Like families under economic stress. We know actually biologically that as temperatures go up, we see increases in psychiatric hospitalizations. I think the way to boil it down is essentially we're human and we're made of protein. And as the temperature goes up, our protein starts to denature. That's kind of the simplest way to think about it, but true, right? Behind the scenes, what's happening is there's a dysregulation of something called the HPA axis. So adrenaline's coming up more, so you're actually more stressed. There are changes to what's going on neurobiologically, changes in serotonin levels, changes in dopamine. This all leads to things like increases in psychotic breaks, increases in panic attacks, that kind of thing. Truly, our resistance goes down because of heat. That is biological. That's, kind of unequivocal. That being said, as a child psychiatrist, I actually have my undergraduate degree was in business, and then I also have a master in education. And so to me, it's way beyond the biology, because what we're talking about with climate is an entirely changing ecosystem. So what we're doing in Darjeeling, India, with my partner, Darjeeling Ladilam Prerna, where Priscilla Giri will be in the next panel, and supported by the Mariwala Health Initiative, with Preeti being here today. We're looking at how to empower farmers locally to become more resilient. And we say that in that, for better or for worse, and this is my own personal opinion, is that climate change is happening. I'm not sure what's going to change right now. I hope it does. In the meantime, people are suffering. So we're bringing people back to their roots, and this is also done with Mike Maturja out of Broadleaf, and then Megan Cherok out of Colorado, thinking about cultivating growth, where we're figuring out what exactly are farmers needing, where farmers in India have amongst the highest suicide rates in the world right now, and understanding how they can become more resilient. And it frankly boils down to economics and how to diversify their income stream, how to diversify their farming practices. And so that's the route we're actually taking. It's very much a sociological approach, not at all medical, because I can only do so much when someone comes in with heat problems, right? The heat's still going to be there, but I can change how they operate. So again, Priscilla is going to talk about this a lot more and is leading the charge. I'm looking at her now. But I think that's the approach that we need to take, is it has to be kind of like a whole field, multidisciplinary approach, because for me, psychiatry medicine, it's a Band-Aid. We need to get to the root of it. And as we don't quite know how climate will change and what it's going to do, we've got to act now with people suffering now. So that's what we're doing.
Okay, great. Thank you so much. So I'd like to move on to Rainer. So given your work with IPCC, how can climate mental health, the research, be better integrated into the discussions on policy?
Oh, that's also something that Ronald mentioned. I also am very much against research just for research sakes, for career progression and so forth. I think every research should have an impulse to those who have been researched, to the communities, and also kicking it up the policy ladder. The IPCC, the one report that I was a part of, did not specifically mention mental health, I'm ashamed to say now. And unfortunately, I'm no longer one of the lead authors, but maybe I can sneak it in through the back door. And I hope I can, because for me, this is also a mental journey here. I'm not a mental health specialist, and I learned so much. And I thank the conveners again for inviting me to this conference. So I think the COPs are now, the climate conferences are now the targets for us. And with my team over there, Julia and Sandra and where's Jamila? There. We want to go to Belém, as we have been going to all climate conferences. But I am ashamed to say I never said the word mental health. But now I will, and we have empirical data. Yay! Now we have empirical data from Brazil, because Julia is from Brazil. Julia, can you stand up, please? Yeah. Julia is a medical student and a wonderful medical student, and she has done this low-hanging fruit research in Brazil, but also now establishing a cohort. And these data we want to share, and talking truth to power. That's the only thing we can do as scientists. And then but we cannot just publish and turn the page. So I'm completely with you, and maybe we should have a talk too. Truth to power, if you like. How can the World Bank put this on their agenda and so forth? So yes, and also I think we should start with where we are. We should not always go to foreign lands and so forth. What can I do myself? Electric cars, and on my own footprint is 11 tons per year. This is much too much, and I've brought it down to 6. But I need to go to 2, which is tough. Everybody has to do this. Then we have to work at the workplace. We have done a study on the carbon footprint of our university hospital, and people fell off their chairs when they learned how much it is. I can invite you to do this here, Singapore, and so forth. And then the city we work, and then the country. So this policy starts from us and then goes to the COP. So I think we should have a multi-level, to put it in a very fashionable term, a multi-level policy implication approach.
Okay, thank you so much. And Emma, you wanted to add on to that a bit?
Yeah, thanks. I just wanted to, in case people aren't familiar, so the last Intergovernmental Panel of Climate Change reports came out a couple of years ago now. They mentioned mental health for the very first time. So they had a section on mental health and the evidence on the impacts for the first time. But actually throughout, even though there's one mental health section on impacts, throughout the reports, it talks about the need for like community participation. It talks about well-being. It talks about, you know, countries with higher participatory governance, higher trust, lower inequality, have lower emissions and higher well-being. So these things are deeply interconnected and sort of inherent throughout the work. But one of the IPCC authors, Dr. Freddie Otto, who's part of Connecting Climate Minds, she was really pushing for mental health to be in the IPCC reports. And she said one of the challenges is the lack of data, particularly from around the world. So, you know, they're wanting to put it in, but sometimes there's just the gaps in the data. And similarly, so COP now we ran the first ever climate and mental health event at a COP so it's never been mentioned at a COP or a climate COP until Glasgow, COP 26. And then a couple of years ago, there was the first ever health day at a COP. And it was a climate and health declaration. And one of my colleagues was working with the presidency. She was the health envoy for COP, and she managed to get mental health and well-being in there, but it wasn't in the draft. Like, she had to work to put it in there, right? So we've kind of got these mentions in there, but it's how that then translates into the actual funding for climate and health. A drop of it goes to mental health. So even though it's in there, it's still the advocacy needed to make that change into the resourcing that can make the change in the research. And I completely agree with everything that's been said on needing to move quickly and not to do research in traditional ways that does the research and then you go, you know, that we're working directly with the policymakers, with the people on the ground. But when the World Bank's asked me and my team, you know, well, what should we recommend? What is the best by intervention? And the truth is I can't tell them that because we don't have the data, right? So I'd be interested, again, you know, we're trying to learn what is needed for the people who are then trying to invest and make the decisions. And sometimes it's, you know, the impacts are there. It's just how are we capturing that? So we can then say to the World Bank, well, actually, this is the evidence. This is the best buy. This is where you should tell countries to put their money. Thank you.
Thank you. And that also leads to my next question, actually, for Ronald. So can you give us an idea of what funding mechanisms can help scale the mental health support, particularly in low and middle income countries?
Thank you. So obviously, I would not want to claim that the World Bank is coming to the table with a ton of money for research. I think just to put a disclaimer upfront, but there are two important things I think in climate change and mental health research. Number one, I think, is the work that looks at the mitigation part in terms of, as we were just mentioning, what can be done now to minimize the carbon footprint, because of course the problem keeps growing, the risk keeps multiplying. And then the second bucket of work really centers around the adaptation in terms of how do we sort of like manage and live within a reality of the fact that, of course, climate change impacts are really manifesting themselves in greater mental health challenges across the world. So those are the two buckets of work streams that we do support. The work actually goes way beyond my practice. It also involves infrastructure and several other parts of the economies. But to come to your question, there are a few, I think, important points. Number one is the World Bank engages a lot with ministries of finance, and those are the most important entry points in any economy in terms of financing and prioritizing funding. External financing comes in, but in my view, especially in Asia, a very dynamic region, lots of economic growth, lots of capacity. The first point that we need to break is basically getting the ministries of finance to allocate more resources towards mental health and climate adaptation. That's the first point and most important, because why? Because that's actually where the bigger, long-term and more sustainable financing would come from. Because we can come in or investors can come in, but it probably will be very narrow and focused on a particular issue. Very delighted to hear that here in Singapore, as always, I think you have been trailblazers in breaking through that cycle and getting the financing to prioritize. Second point is, what surveillance mechanisms do we put in place, especially in the aftermath of disasters? Because I do feel that's where the data that you're talking about really could come in quantifiable ways that can actually then be used in a long-term way. We do reports in the World Bank known as climate change development reports. We used to call them diagnostic reports, but we moved away from that. And my colleague, Dr. Seng, has been involved in that in Vietnam, where we really have been looking at what data exists, really to highlight. For example, in Philippines, we know that there's Eastern Seaboard, where the provinces that tend to get impacted most by typhoons, the families get disrupted access to healthcare, but there was no rigorous evidence that we could use when we're doing that report. Same thing when you look at like Eastern Indonesia and the Pacific. So the first part is, what surveillance mechanisms do we have that really can help generate data on an ongoing basis? Because it is out of this surveillance system that you're actually going to be able to generate hopefully more meaningful and long-term data. The next part that I wanted just to mention is around some of the community-based interventions that respond to the climate change, health, and mental health nexus. And here I was actually in Korea with Dr. Enkle in June, where we were engaging with some of the stakeholders in government and outside government in Seoul that are basically implementing community-based interventions. Because why community-based interventions? I do feel that mental health, climate change nexus requires very practical, targeted, and tangible actions. It's not something that you can keep in a well-ventilated conference rooms. You really need it to be on the ground for it to be real. So I do feel that a combination of government financing, maybe development bank financing, but most importantly also foundation financing that really goes towards supporting well-designed interventions at the community level is going to be very critical. When we're in Korea, we're actually sort of like confronted by a reality in the dimension of mental health, partly of course linked to climate change, that we're not so used to, which basically was the teenage mental health crisis, because kids are mostly like indoors on gadgets and isolated. But how do you then come with intervention that basically would target, get to that cohort in a very effective way and practical way, which is obviously where the community-based and very targeted, culturally sensitive interventions would come in. So I just really would like to sort of like challenge all of us in this room that I think we have to look at the response to the climate change, mental health nexus, I think as a call for us to have a community of practice that actually brings together development banks, academic institutions, for me, most importantly, the treasuries of the country. Because of course, at the end of the day, what gets financed in some ways gets implemented. What doesn't get financed, even if it's well designed on paper or intention, never happens. So let me stop with that. But I do really feel that this is a very good convergence, and I really hope that we can begin to build a community of practice, including, of course, the activists going forward. Thank you.
Thank you very much. So we have just about 5 minutes, and I'd like to also take some questions from the audience. So if you have a question, please make your way to the middle. There are microphones there, and if you could give us your name and where you're from. Oh, okay. Okay, we'll have about 2 to 3 questions. So, okay, we've got 4 people standing. So we can just do you 4 that are standing right now. We can take your questions and then we'll close up. So first up, on this side on my left.
Thank you. My name is Bryden. I'm a psychologist from Australia, and my pronouns are he, him. I'm also neurodivergent as well. I've loved the discussions here so far, and we've got the intersection of mental health and climate change. We've also talked about the importance of data and collection to be able to inform decision-making and funding for different interventions. I'm curious how minorities, such as the LGBT community and the intersections within that, and the neurodivergent community, because neurodivergence is a neurodevelopmental issue, not a mental health issue. How might we be able to capture the data of the experiences of those minorities and those intersectional minorities within the data of research and health intelligence, so that they're not forgotten or not heard within mental health and climate change?
Okay, so okay, so that's the first question. We'll collect all the questions and then we'll have the panelists answer. Okay, we'll just start with this side. Everyone can go and then we'll get your question last.
Okay, thank you very much. My name is Afi. I'm from Indonesia, where the hottest country maybe on earth. So I'm interested in what Professor Rayner is take with the heat, the correlation with the heat and also with the mental health well-being, because I live in a hot country where 36 Celsius can be inside the house. And I used to work in a semi-outdoor office where I have to like open my laptop and feeling the heat, and I feel like the stress is piled up because of the increasing heat over time. So I think it is correlated to the how maybe our body is adapting, right, with the heat over time, but actually maybe our mental health is not really well because the stress is piled up over time. So it's not the intervention, I feel like it's not about the nature or maybe like hugging trees or something, because nature is not nurturing anymore, right? So maybe it's the intervention is like ice bath or something. Yeah, it's temperature therapy. What is I think what is another options about the interventions? Maybe like the interventions is not the mental health itself, but also the source of the problems. Thank you.
Thank you. Next question.
Hi guys, I'm Sanju from Bangkok, Thailand. My heart is racing right now because this is such an important topic that we really need to discuss. And I love what you shared, that burnout, people burn the planet and burn people out as well. And I think as John and Ronald also shared, ASEAN is very vulnerable to climate change, and vulnerable people are the least prepared to cope and least prepared to recover as well. And Reina, yesterday we had a quick conversation where you also shared that youth are losing hope. And I think that loss in hope is also because the world leader is talking about drilling back into fossil fuels, and that AI technology and EVs are coming up, but yet countries rich in cobalt and lithium are the ones to be exploited for these resources as well. And as Christina shared, that psychiatry and psychological intervention is just a band-aid for all the issue that is happening. And then Emma, you talked about that we should not work in silo, but rather work together collectively to solve this issue. So how can a country that is trying to catch up economically and many times are the one that is to be exploited by the global north in terms of labor and resources take charge and lead change, since many countries are still catching up with the industrial revolution as well? And if the panel can share any success stories from the global south that is actually taking charge in creating change as well.
Okay, thank you. And last question right here.
Morning. Like Maturja, as Christina mentioned, a colleague focused on advancing health and mental health in the Eastern Himalayas broadly. My question is for Emma. You mentioned that you're not yet at a point that we can recommend best buys or most impactful community-based interventions. In your opinion, how are we going to get there? What are going to be the key drivers so that we can put evidence into action over the coming years?
Okay, thank you very much. So first question was about neurodivergent and minorities, and is that Professor
Yes,
Reina? Okay.
is it Brian? You see, I didn't take your card by chance this morning because LGBT people are not visible in surveys, particularly not, as far as I know, in mental health, and certainly not in mental health and climate change surveys. So we will hopefully communicate on this, how to ask for this very taboo topic in surveys. So thank you for mentioning this. The lady from Indonesia, yes, where are you? Ah, there, okay. Yes, you suffer from heat, and heat has a physiological effect on you, meaning stress and meaning heart and adrenaline, as Christina said, and there's a cascade of neurotransmitters that's kicked off. But it also, 2 degrees more halves your work capacity. That's something for the World Bank to worry about, and for all of us to worry about. And it includes intellectual work. Sitting at a computer, you all know this, in the open, and you stare at the screen and nothing comes. So for farmers, it's essential to work in the heat, and they can't. So they are between a rock and a hard place. Either I feed my family and ruin my health and get my core temperature gets high, which is lethal, it's very dangerous, or I take care of my health and my family goes hungry. So there is something on harvest output, there's something on intellectual capacity. Construction workers, there are many here I've seen in Singapore, they are exposed. There is one intervention on homes we've tested, that's the cool roofs. We may talk about this. So on corrugated iron roofs or on mud roofs, or even in New York to save on AC spending, there are particular, it's not only paint, it's a kind of plastic that insulates and that reflects the heat. And it's 2 degrees cooler inside as it would be without it. So maybe we could talk about this and start a trial there. So that's my quick comments on the heat business and on the neurodivergent. We'll stay in contact.
I wanted to add for Brian's point. So part of what we do in Darjeeling and in Manila, actually, the model is called community-initiated care. It's been around for a while, but only come into the literature in the last 2 or 3 years. There's a paper by Siddiqui. And it's backed by the Wellbeing Trust. So I think it has to come from the community. The researchers are not going to get there in time. So it's community care starts where the community's interventions, whatever is happening, for me, it's mental health, then becomes part of research, and you somehow get it into the ethos and the literature. And I think that's how you're going to have to go for your community, and that I think researchers just can't get everywhere. And I'll just briefly comment on whatever is happening in the United States, where I'm faculty right now. I think we really all have to take into our own hands, as currently living in Manila, control of the funding of the research. And so you start with community-initiated care, which is whatever the community is already doing, whether teacher, firefighter, cop, they add into their daily workflow a little bit of whatever you're looking to do, health, mental health. And so that's also how you collect your own data to then put it forward. That's part of how we've situated TLEAF in India, as well as the climate change and mental health piece. And so you need champions within the communities to do it. Otherwise, unfortunately, I don't see a coordinated effort to be able to do it.
Yeah, I want to comment to our sister from Indonesia, beautiful country. On heat and mental health, there are emerging evidence that heat is related to mental health. There's very good evidence coming out of from Indonesia. They have multi-city uh, evidence that increased heat over time relates to psychiatric intake. That also those who already have mental health problems are less able to manage or respond effectively in times of heat wave. There is also evidence that heat is associated with domestic violence and sexual violence, and that are those are good flavors for mental health problems. In terms of, we also know that our outdoor workers, as Rainer mentioned, are very much exposed to heat, and therefore they are more prone to the psychological impacts of that. I have some students in Manila studying commuters and its impact on their psychological health. Because if you commute in Manila, it's like a 5 kilometer ride would take you 2 hours. It's crazy. And in terms of interventions, we know that there are people who find their own ways to adapt. There are creative ways, but we know that planting trees is an intervention, in cooling effect. But what I learned from conservation scientists is that if we plant trees, make sure it's a native tree. Because if it's not a native tree, the ecosystem dies, right? Because the other species don't benefit from it. So plant tree, but a native tree.
Yeah,
Thank you.
This is such a rich discussion, and yeah, please come and talk to us like in the break because there's so much more to say. I'll try and be quick through. So, Bryden, thanks for the question. I'm also neurodivergent, and neurodivergence within the climate movement is something that has been, I guess, growing in awareness because there is a lot of unique kind of insights or perspectives that people with neurodivergence are sort of bringing to the community, but it hasn't been fully captured in climate mental health yet. I have some colleagues who are working on that. I can connect you. But one of the challenges is also capturing that in data. It's often just not captured in data sets. And so we're doing a project at the moment doing group discussions with young people. And one of the reasons for doing that sort of qualitative work was to try and really unpack how their experiences do intersect with their identity, with their culture, with their place, with all of these other things that are going on in their lives that you can maybe unpack more in a discussion rather than in most of the data on young people at the moment has been survey-based. Just on the question about, so selamat pagi to our Indonesian friends. But yeah, heat and mental health is just one example of the many, many, many different pathways and mechanisms as well. We heard in Connecting Climate Minds, people are being trapped in their houses because it's too hot to go out. So they're socially isolated, which is increasing their mental health effects. Children can't go to school. They're saying, I can't go outside and play. So that, they can't sleep. So we had some, but there's multiple mechanisms. People with schizophrenia represented 8% of people who died in the Canadian heat dome, way higher than, the people who live with schizophrenia in the population. So this is just one example, but it's really underappreciated in mental health care, but it's also underappreciated in how it's captured in discussions about climate action, right? Which is still often seen as something out there as opposed to affecting people's lives, workers. And so that's part of the narratives that we take out and try and change the conversation. In terms of the third one was on, Global South and examples and initiatives. So one thing, just because of time, is to say to check out the hub where we do have case studies from around the world, including in the Global South. But there's really, so in Australia, for instance, some First Nations communities are leading like Caring for Country initiatives, which have also been evaluated for the mental health and wellbeing benefits that come from those initiatives that are helping to sustain and actually through like traditional fire burning, et cetera, stopping the huge wildfires that or lowering the risk that then also lowers emissions. And so there's these links and these benefits, but there's a lot of different case studies. In terms of countries, at a country level, just to know that the national adaptation plans and nationally determined contributions for countries are coming out now, which are the plans for how countries are going to reduce their greenhouse gas emissions and how they're going to adapt. And it's really important to have advocacy for mental health to be considered and included in that. So if you're interested in that, also we're working and also with United for Global Mental Health on trying to advocate for that, because most plans do not have that or only mention it very briefly. In terms of the interventions and how do we get there? What do we need to do? I think there's a few things that we're trying to do. I mean, one big challenge is honestly in the funding space. So if anyone here is working with funders, advocating for funders, like this is something that we need to just make the pie bigger in this space. But second, what we need to do is also elevate and identify what's already happening and connect that, which is what we're trying to do through the Connecting Climate Minds Global Hub and other initiatives. The third is how do we partner with and accompany as researchers those interventions so that there is that sort of evidence around that, but in an appropriate way. And we're doing that through the development of these observatories. So if anyone's interested in joining that, we'd love for you to join us. And the fourth is actually how do we measure this, right? So I know some friends from Origin here are also trying to work on this, and then they've got amazing work that's just getting off the ground in this space. So go and talk to them, and I'm hoping to work with them as well on this project of how we actually measure. I'll stop there, but yeah, love to talk to you all afterwards too.
Thank you so much. And unfortunately, we don't have much time. I see some people are standing up, but we have to close up the session, but we'll be here all day. So I do encourage you all to continue. Sorry, do you have a quick question?
No, just very quickly, since we're out of time, I wanted actually just to say, Emma, your work on the best buy interventions is actually very critical. I think it's an area that we need to develop more and more. And here's why. When you look at how the ministries of health engage with the Ministry of Finance, always the question goes back to, number one, what are the best buy interventions? Because we cannot just give you new money without being very clear on where it's going towards. So I just wanted to reiterate the importance of that work. I think it's something that we need to take forward very seriously. And very quickly, I think we need to stimulate demand for action, both in terms of financing and programs. And how do we do that? Engaging also with Parliament and parliamentarians is also a very good avenue, especially if you get very good leadership. Then it becomes domestic, and actually more authentic than I think sort of like pushing it purely sort of like as a research effort. And then my last point is, because I support a number of countries across the region, I do see that there's a growing board of research on climate change and health-related risks, but it's still broad. The mental health element is actually missing to some extent. So I think it's very important that I think we begin to engage also so that that dimension actually comes out in a very prominent way. Otherwise, there'll be a ton of very general evidence that basically would not really be helpful on the climate change and mental health nexus.
Yeah.
Just wanted to conclude with those points. Thank you.
And actually, a lot of climate and health work is already happening. You need to integrate mental health into it. Sorry, just to say, there's a lot that we can do with our colleagues in climate and health to already not reinvent the wheel.
Okay, thank you so much. This was a very great discussion, and I really appreciate all your insights. Everyone, please thank our panelists for their.
And thank you, Nyaya, for that excellent moderation. If you have a few minutes less for coffee break, blame it on Emma. No, just kidding. No, but this is just the start, right? This is just the beginning, and we're already having this exciting, energetic conversation. So more to come in the next few hours. So we'll just have a quick coffee break, maybe around 20 minutes. We will be setting up a climate emotions wheel wall, or not really wall, it's a board. And we would love you to indicate what are you feeling now when it comes to climate, which Antea already started during her keynote, but there will be a wheel, please visit it. And yeah, let's connect, explore, co-incubate ideas, and then ask for the World Bank for more money for projects. See you there.